Well, talking with Howard Quayle, you've got a new CEO coming in to take up the position from the UK. Of course, now doesn't need a work permit.
Yeah.
What makes Mark Charters so appealing for the job?
Well, first and foremost, can I say I'm just delighted that we're getting Mark. We had an incredibly high standard of applicant for this job, which it had been worrying. You know, I knew that we needed a really good chief executive officer with a lot of experience. Was I going to attract that caliber of person? And we had a really good short list to go through. Mark has incredible experience in turning around failing social care services in London. He's done it with children's services and he's done it with the health service. So he's early 50s, he's lived on islands, rides a Harley Davidson, loves the Isle of Man, really committed to coming here, has a very good pedigree, and I really feel that we've found the right person. Politicians come and go. We need a top team in charge of this. This is the biggest spending department of government. It's got major changes with an ageing demographics. 3.2 people now working for everyone over the age of 65. When you and I are retired, there'll only be 1.8 people working for everyone over the age of 65. We need to fix the current system, and then we need to come up with a brand new health and social care policy going forward that's affordable and delivers a service that we, when we are, in need of that service, because obviously the older you are, the more requirements you have for this department. We need to make sure it's affordable and deliverable.
How much are you paying him?
He's getting the same salary grades as the previous chief executive officer.
So in this day of enlightenment, you can't tell me the actual money?
I can't tell you the exact. There is a band.
But he was on 153,000 in London on his last job, wasn't he? He's at the top of his bands,
Yeah.
From what research I've done him. So would that be the sort of area we're talking about?
He has taken a cut to come and do this job.
Fine. You are happy now with the way this department's running, or the two departments, because you are seen as
yes, I'm
putting through your ideas quite fast now, aren't you?
Well, that's what I do anyway, and we're not rushing in, fools rush in where angels fear to tread. There's an awful lot of work. I'm just coming up with, there's an awful lot of things going on in the background, and over the coming 6-12 months I hopefully will be coming up with some really good news stories of changes and improvements that we're making in the Department of Health and Social Care. Mark is a key element. Obviously, there's three top positions that I needed to fill. The medical director, where we're shortlisting for, the director of acute medical services, the running of the hospital, and the consultants. That's the closing date has just gone, so I'll need to see who we've attracted to the position. So when I get those three positions in place, then with a top team, we will be able to make the improvements where they need to be and deliver. We must deliver a health service and a social care service that the people of the Isle of Man deserve.
Let's deal with the hospital. What's morale like from your point of view? Have you any idea? Do you get in, hands dirty up there? Do you go in and see people?
I have been around a significant area of the hospital.
Unannounced, you just go in there, or is it all planned for you?
Some of it's planned. Obviously, I can't just walk in unannounced. They're carrying out surgical procedures.
But you know what I'm trying to say?
Yeah.
Things can be made look nicer for you.
I do not take senior management around with me. I like to go around and meet the troops at the coalface.
And what's it like up there?
The staff are highly dedicated and committed. They want to see change. They're waiting to see what changes I'm going to make, and I'm going to communicate with them as much as possible. What the vision is, where we're going to be making improvements, how we're going to improve.
So what's it like up there now? What's the morale like at the moment? Would you still say it's still quite low?
I would say there's certain areas of improvement in staff morale, and I will work hard to. All the changes I'm making is to make it better for the staff and the people. The people of the Isle of Man first, but the people, the staff and my colleagues in the health and social care service. I want to make it a much more enjoyable experience to work for us.
And Mr. Charters has got to sell himself to the staff as well, hasn't he? I mean,
he has, but he comes with a fantastic pedigree. He has a proven track record. He has qualifications in social care, but he has turned around an organisation far bigger than on the island. So he's not untried and untested. He has a pedigree, and I think the staff will respect that. We will respect him because we have attracted a top person to the job.
Did it help not having to go for the work permit now, because these positions have been excluded? Did that help you get these
Well,
people?
it makes it a simpler thing. I was clear in my mind that I wanted the very best, and I didn't matter where they came from, who they were. The people of the Isle of Man deserve the very best, and I didn't want to be shackled by only having to take, you know, from one area. And it could well be that if a local person had been the best, I would have delightfully taken that local person. However, Mark turned out to be the best candidate, and we have got the best.
And when's he starting?
He starts at the beginning of July.
And when will we get to meet him?
Give him a few days to settle in, and I'm sure we'll set up all the interviews for you.